I'm John Badia. I'm the clinical officer in charge, Lwala Health Center, and let me show you around. We'll start by different sections. We've got the data office, we've got the administration, and then finally the injection room and the consultation room. We'll start with the data room. So this is the data room. We have Richard here, and we've got Susie the other side. Basically, this is where we get our first contact with our patients. We get our records before they move into the consultation and injection room, which I'll show you. The kind of sicknesses that we often see here are different depending on the age. Mostly for children, we've got malaria, diarrheal diseases, and a bit of skin diseases. But for adults, is basically sexually transmitted infection, a bit of pneumonia, and mostly malaria too, as the children are also included. This is the other room where we get our observation. And as it is right now, we've got a patient who is under observation on IV quinine because of malaria. She's a 35-year-old man who's been apparently ill for the last 3 days. Came in today. We did a blood slide for malaria after consultation, and we found out to be having malaria. So our next building is the laboratory, and the person in charge of the laboratory is Michael Ndick, and we actually want to see how he's doing. One, he does the routine laboratory checks. He does counseling for patients, which we call patient-initiated testing and counseling, and he also does a little bit of recording as pertains to the laboratory. So these are patients from the locality, from the Lwala community and abroad. They come here to get the medication, different kind of medication. Either they've got malaria, they've got pneumonia, or they got diarrheal disease. This is where they come to get their disease, and before they get to either of the consultation, this is where they sit to wait for their names to be called before they get to the consultation rooms. So the fourth room, this other side, is the injection room. We've got a couple of things getting in around this place. So welcome to the injection rooms. We take basic vitals for the patients, and we do initial checkup so that once the patient gets to the consultation room, he's got all the workup and the checkup done. So it's only consultation done the other side. Now we're heading to the consultation room. This is my office where I consult. I see patients here. I do basic consultation. I do minor investigations. For example, speculum examination for basically from the other side of the bench. And I also keep my data this other side for reference and for guidelines to see how things are and moving on. In the pharmacy, we've got two divisions. There's a inner store and the outer dispensing unit. So welcome to the pharmacy. What happens in this room is we do the regular dispensation, unlike the other room where we do strictly antiretroviral dispensation. Here, Nick gets consultation from, letters from consultation from the doctor and dispense. This includes anti-malarial, antibiotics, and a bit of antifungals. Okay. So in the main store, we've got Dennis, who is in charge. He keeps record of all the drugs in the pharmacy. And other than that, he also gets a dispensing unit for HIV patients. drugs that we run out of stock are the anti-malarials. At the moment, we buy so much at the moment. We buy quite so much, but because of the continuous need of patients with malaria, we run out of stock of anti-malaria so often. The other drug second that runs out of stock are the children antibiotics. They are there in plenty, yes, but actually the need, depending on the season, actually does the stock. I mean, the stock just runs out of. I mean, before the right time comes. Thank you for coming, and see you again soon.